What are carbamate insecticides? Carbamate insecticides, used to kill or control insects, are made from carbamic acid. There are many forms of carbamates, each different in the way they work and in their poisonous effects. Carbamates break down in the environment within weeks or months. Where can carbamate insecticides be found and how are they used? Carbamates are used as sprays or baits to kill insects by affecting their brains and nervous systems. They are used on crops and in the home to kill cockroaches, ants, fleas, crickets, aphids, scale, whitefly, lacebugs, and mealybugs. Some carbamates control mosquitoes. Some carbamates have been found in groundwater at levels high enough to cause concern. How can people be exposed to carbamate insecticides? The most important human exposure route is through the skin. However, exposure can also occur through breathing carbamates, eating food, or drinking groundwater in contact with carbamates. Farm workers and people whose work involves applying insecticides are the most likely to be affected. A low level of exposure may result from using carbamates to kill insects in the home or yard and would not be expected to have major health effects. How do carbamate insecticides work and how can they affect my health? Carbamate exposure can cause headaches, dizziness, or weakness. It can cause nausea, shaking, stomach cramps, diarrhea, and sweating. Skin exposure to carbamates causes a minor rash. Long-term exposure can result in loss of appetite, weakness, weight loss, and a general feeling of sickness. There is not enough information about carbamates to know if they cause cancer in humans. How is carbamate insecticide poisoning treated? Carbamate poisoning is treated with a substance called atropine. What should I do if exposed to carbamate insecticides? If you breathe carbamates, get fresh air right away. Get medical help. Artificial respiration may be needed. If you touch carbamates, remove clothes that contacted the insecticide. Rinse and then wash skin well with water and soap. Get medical help. If you get carbamates in your eyes, remove contact lenses if you can do it easily. Rinse your eyes with plenty of water for several minutes. Get medical help. If you swallow carbamates, get medical help. What factors limit use or exposure to carbamate insecticides? You can limit exposure by avoiding household insecticides containing carbamates. Follow product directions if they are used. If you are near an area where carbamates are found in drinking water, use bottled water or an alternate water supply. If you work where carbamates are made or used, follow all health and safety rules. Is there a medical test to show whether I've been exposed to carbamate insecticides? A blood test can show possible exposure to carbamate insecticides. The test should be done within 48 hours of exposure. Technical information and resources can be found in the video description.